not listening to Lil Wayne while you edge or weed whack, you're doing it wrong. Do yourself a favor. I am a chiropractor, or as my 2-year-old likes to say, I help boo-boos in your back. So however you like to think about it like that, just remember us. Chiropractors operate under the philosophy that the nervous system controls everything in our body. And if it's allowed to do that uninterrupted, that's where we're going to find optimal health, right? If we start to add restrictions, if we start to add any type of interference with it, that's where we're going to find dysfunction, we're going to find pain, we're going to find disease and everything else. So we have these beautiful organs, brain, spinal cord, they live in these movable bones in our back. It's my job to find any restriction in those bones and kind of release it, and like we said before, of course, unlock the power of the body. You've heard me say before, structure governs function. Proper structure equals optimal function. If something is wrong, if there's some pain, if there's dysfunction, let's look back to the structure and figure out what the hell's going on. And we want to get to the core of it. We don't want to just cover it up with pills and medication. All right, so we're gonna go through a couple things. I'm going to show you some X-rays, what we're looking for when we see X-rays, an actual patient visit that came in. So with chiropractic, there's a lot of different benefits with it. As you can understand, if we free the nervous system, there's a lot of good that can come out of it. We're typically known for neck and back pain. So today, specifically, we're going to talk about the neck in the interest of time. Okay. So this is what we refer to a near perfect cervical X-ray. Okay. So of the neck, this person is facing towards the window, and there's a couple of things that I want to point out. There's a really beautiful curve here. Okay. The curve acts as a shock absorber and a weight distributor. When we look at films, we want to keep in mind a couple things, A, B, and C. Alignment, bone, and cartilage. Okay, so we saw the alignment, the curve is present, the head is above the shoulders, everything is positioned appropriately. The bone structures, we don't see any spurring, we don't see any breaks, of course. We don't see any osteoporosis or any translucency. In between here, this is where the discs live. I mean, I'm sure you've heard people say, I slipped a disc, or I herniated a disc, I bulged a disc, whatever. This is where they live in here. Okay, we see them all equally spaced. All right, they're again providing support and structure within this person. Sometimes we encounter a trauma. We fall, we get in a car accident, whatever. Other times it happens gradually over time. Either way, it can happen. So again, on top we see what we refer to as normal. Right? Again, over time, trauma, whatever the case may be, we start to undergo these changes in our body. We'll see the radiograph, the X-ray on one side, and then some of the symptoms on the other side that we look for. So phase 1, we start to see the loss of the curve. Phase 2, you start to almost see what appears to be like stalactites in a cave. Things that are growing on them, the decrease of the disc material as well. Phase 3, it's almost going in the opposite direction. This is irreversible chronic pain. It's a non-stop thing. Some of these things we can reverse, some of them we cannot. So it's always better to get in earlier than later. Okay, so let's talk about this patient that came in. This is a real life patient. I won't give you her name. I will give you her social security number, her PIN, her mother's maiden name. So she's a 23-year-old female. She presents with constant neck pain for the last several months that radiates into shoulders, as well as frequent headaches. She works at a desk all day, has a sedentary life, in multiple car accidents. She does like using her phone a lot, so she's looking down a lot. She's on a computer a lot, okay? So here it is. She's been taking Tylenol. It's not really helping, so she comes in. So whenever somebody comes in, we do a couple things. We take a full history. Where have you been? Who have you seen? How'd you get here? We do an examination. Hey, can you turn this way? Does it hurt my press here? Things like that. So we found out that she had some reduced range of motion, some painful palpation when I touched certain spots of her neck. Then we look at X-rays. Now keep in mind what we just saw. This girl's 23. Here she is. Okay, so Couple things that I want you to notice, I put up here. Where's the curve? It's gone. Her head is forward, all right? Sometimes it's been said that every inch forward that the head goes, another 10 pounds of pressure, okay? The head's about 10 pounds-ish, okay? So we also saw, going back to this slide, what that might indicate for this particular person. Headaches, neck pain, strained muscle, shoulder tension. What did she tell us when she first came in? She has neck pain, headache, shoulder tension, right? So we look back at the x-ray again, and there we are. So some of her habits over the last few years have led her to this. Pretty easy fix when we talk about this. So we started her on some chiropractic treatment. So what exactly is chiropractic treatment? I talked about it in the intro. We're looking at these movable bones in our neck and our spine and getting them to move. These, of course, haven't moved in a while. So we started her on some chiropractic adjustments, eventually started her on some postural exercises. She's a little more cognizant of what she does during the day. After 1 week, we noticed a decrease in symptoms by about 60%. She was pretty excited about it. And by the 4th week, the symptoms were all but gone. She continues supportive care. She comes in once every other week or so. And like I said before, is cognizant of her postural goals, tries to get her phone up in front of her instead of looking down, adjusted the monitor on her computer at work. Okay, we'll get into referrals. We have 5 minutes.
Down the side.
Okay, cool. So referrals. So people talk about pain all the time. It's a pretty common thing. There's an opioid epidemic right now. There's a lot of people that are suffering. So where do these people go? Their first points of contact are these initial, immediate care, urgent care, MASHs, ERs, right? So I want some contact points for these folks. It doesn't have to necessarily be a treating physician. Is it somebody that's in this facility, or it could be a treating physician? I want to meet them, give them some options to send these people to us for less pain medication, and again, to kind of get to more of the root of this problem. When they go to an ER or immediate care or something like that, what usually happens? They get prescribed something and they get sent to their primary care for a follow-up. See your primary care, they'll know what to do. Primary care sees them and says, I don't really know what to do with this. Have you tried Tylenol? Have you tried ibuprofen? Oh, you have? Well then, maybe physical therapy or whatever will help you as well. I really want, this is my push this year, is I really want to meet some more primary care physicians and again, tell them what chiropractic can do for those patients that are suffering. Next thing, specialty docs, same thing. If they're a non-surgical patient like this particular woman is, maybe she's gone through the list of providers and she gets to an orthopedic surgeon and they're like, yeah, we're not going to cut you, you're 23, there's not much going on with you right now, try some more conservative care. Again, really great referral for us there as well. And then finally, personal injury attorneys. People get hurt, people get in accidents, they fall, they do all kinds of crazy stuff. Really nice referral for us there as well. So in wrapping up, we don't provide medication. We don't inject you with any needles or anything like that. We don't operate on you. We're simply looking at your structure. We're trying to make it function the best that we possibly can in order for you to have optimal function. So thanks for the time. My name is Punturiero. I'm a chiropractor with Back to Basics Chiropractic. Thank you.